I want to talk a lot about medical billing, Medicare, a little bit of Medicare Advantage. And I think all wrapped up into that is documentation, right? Like that's, oof, right?
That
You
is
and I have a lot of
correct.
talks about documentation.
Yes, and I think that the biggest shift there in documentation mindset is in dentistry, we're often taught to document what we did, not necessarily why we did it. In
Yeah.
fact, coded for trauma for years, and doctors put AA, automobile accident, when in fact with medical billing, we need to know, are they a passenger, what type of a vehicle, etc. So you're
Mhm.
correct, Teresa, as usual. It's documentation. Make sure you document, even if we involve the patient and have them fill out an accident form. But yes, documentation is key.
Honestly, there should be like a billboard up the state of documentation in dentistry, and it's just like fail. Like, maybe we move towards getting better, but usually it's fail.
Yeah.
So. I remember when I first started speaking for, and this is where I met you, Leslie, the International Congress of Oral Implantologists. The auxiliary section was called the Association of Dental Implant Auxiliary, so ADIA. And Leslie and I were both speakers for the ADIA, and that's how we met a long time ago. But I remember Lynn Mortilla. She's been married since, but to me, she's always Lynn Mortilla. But she was a mentor for me, and I owe her a lot for getting my career started. But I remember she said, it was my very first speaking gig. And she said, can you talk on insurance for implants? And I said, oh, yeah, I can. And then she said, okay, well, we need something on medical too. And I said, oh, no, 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 no. And it was my very first. And she said, okay, we'll talk about the dental implant codes, which I think back then we had like, I don't know, 5.
Right.
Then she said, well, what about medical? And I said, okay, I'll put up a slide, but that's it. And I remember thinking then, I hope nobody ever calls me for this, because the research I did just to create those 2 slides was enough, right? But then I remember you started coming in and you started speaking on medical billing. And between you and Christine, I realized I have no idea what I'm doing. So what do you remember from those early days of medical billing for implants? Do you remember we had like 2 codes and there was like 1 CPT code that we could use pretty much? So what do you remember from those days?
Oh, well, first of all, it has changed since then, and really for the better, because I think that was 2010 that we started speaking. It's been a long time.
Long
A
time.
couple of the big new advances that have been helpful, and if you have any knowledge of medical billing, there's really 2 sets of procedure codes. There's the CPT, the current procedure terminology, and then there's the HCPCS, which is really the void of codes that are not in the CPT codes. And the D codes, our ADA's, D codes, were added as HCPCS codes about 5 years or 6 years ago. That has been huge, because medical payers can, look at a D code and say, okay, this is a HCPCS code, and they'll have a definition of what that is. So that was one of the big advancements. The next advancement is one that you're well aware of and may have already spoken about, is Medicare allowing dental claim forms to be submitted electronically, as long as they have the diagnosis codes, the ICD-10, in July of 2024. So first of all, that's a big wow moment that the oral systemic link is getting more recognized by physicians. I know I've seen you post some articles about that and some physicians that are talking about it. And I think those 2 big things have really helped our industry. I used to have a harder time back when I started in oral surgery communicating the procedure to payers, where now it's okay, well, if I put the D7240, then they know the degree of difficulty of the extraction. So since we did this back in 2010, there's been some real wins. And then there's been some more confusion too. So we can talk about that as well.
Oh, yeah.
But
There's always confusion when it comes to just coding in general, but then the complexity of medical billing. And so I encourage any of you who are thinking that this could add profitability to your office, go slowly, because getting involved with the government is always something to beware of. And, medical billing in and of itself is medical billing, but medical billing with Medicare is a totally different animal. We'll talk a little bit about that. And before anybody starts asking Google for HCPCS, it's HCPCS,
yes,
right? And
yes.
it's not actually Hicks and
Healthcare
Picks. Like,
professional, coding
yeah, because I remember
system.
starting out, like I would hear HCPCS and I'm like, what is a Hick? I don't know these things. So yeah, so there's lots of acronyms. Oh my gosh, the acronyms that we have to know. Would you like to hear more? Follow the link for the full episode.